First, I just want to say thank you again to everyone here who has been part of this extraordinary community of community health centers over this, and not just over the last many years, but in particular over the last 22 months. This has been a really tough time to be a clinician. It's been a tough time to have so many people rely on you, looking to you when you yourself might have, at many points in these last 2 years, wondered what the answers were. I've been uncertain about what the right path forward is. It's one thing when you've got a patient who's got an illness, you know exactly what to do, and you've got the resources at your fingertips to deliver. It's a whole other question when the answers aren't so clear and the resources aren't available. But that is what you not only deal with every day, but what you particularly had to contend with during this pandemic. I will tell you also at many points when we were talking about the vaccination effort, at HHS and the White House and mapping out the broader strategy, community health centers came up all the time. And you see that reflected in this strategy that was ultimately rolled out. So I think there was a recognition, not just here, but I think a growing recognition in the country, that community health centers represent a critical backbone of our health system, not just because there are healthcare providers there, not just because there are physical buildings that exist in communities, but because of an intangible that you have built, because of your integrity and hard work, and that is trust. And vaccination campaigns move at the speed of trust. Healthcare moves at the speed of trust. Without trust, we can't deliver care to people who need them. That is the currency that you have built, over years and years of incredible hard work and sacrifice. And I just want to recognize how valuable that is in our ultimate goal, which is to provide good, equitable care to everyone. And finally, I just want to recognize this moment that we're in, as painful as it has been. And while at times it seems like it's never ending, especially with a new unknown variant on the horizon. I just want to remind people that we have come a long way in the last 22 months. And just think about this, just 1 year ago, we didn't have vaccines available to give people. We didn't have the prospect of two oral therapeutics, on the horizon that might significantly reduce the risk of hospitalization and death. We didn't have, monoclonal antibodies available to the extent that we have now. We did not have so much of what we have right now. And what that's enabled us to do is save a lot of lives, frankly, and keep a lot of people out of the hospital. The fact that so many people still are losing their lives and are hospitalized from COVID is a testament to just how robust and hardy the Delta variant is. And it's a tougher foe than what we were dealing with last year. But we've continued to see even there, if we can get people vaccinated and boosted, we can help them, we can protect them. And some of these other measures that all of you have been advising your patients on, and that you have been advocating for in communities, including masking and better ventilation and making sure that people have the opportunity to test whenever possible. These are also strategies that we know help to reduce risk. So we are in a better place. We have so much more know-how about how to protect ourselves. But to me, one of the greatest ways that we can honor the people who have lost their lives to this pandemic, including a number of my family members who have lost their lives, and many of your family and friends who I suspect folks on this call have lost loved ones to the virus. I think one of the greatest ways that we can honor them is to make sure that we build a healthcare system, a public health system, that makes this kind of toll much less likely in the future, that actually provides the kind of care to people that they truly need and deserve, and does so in an equitable way, and recognizing that equity is more than a buzzword. It's more than a box that we check, right? It's more than in the numbers that show up on a spreadsheet or on an output report. Equity is really fundamentally a value. It's about how we choose to see the world. And I use that word choose intentionally, because just by coming together, right, as a community, we made a decision that we want to be together, that there are certain rules that we want to live by, values that we want to build our community on. And those values were very clear to people like my parents, who are immigrants who came to this country 4 decades ago. But whether you came 4 decades ago or a couple hundred years ago, or whether you've been here all along, the bottom line is we made, in some ways, a decision by being a part of a community that there are certain values that we wanted to live by. For my parents, those values were the notion that our kids would be able to grow up and live in a society where they were treated fairly and where they were respected because they were human beings, where they were given access to opportunity and to resources, not because they were connected, or because they had the right last name, or because they were belonged to a particular racial group or caste, but because they were human beings who had just as much value and worth as any other human being. And there have been times for sure when they haven't seen those values played out, in society. But I will tell you that there are many times where we have seen those values played out. We've seen the generosity of public school teachers who made sure that my sister and I, even though we were, funny looking kids with funny sounding names, that we had as much attention and opportunity, as other kids did. We were the beneficiaries of a healthcare system that made sure that when we got sick, and there were times where we did get sick, that we could actually get care. That my parents could rest assured at night that if a healthcare need arose, that they wouldn't be a parent who couldn't provide for the care and well-being of their children. But we know that not everyone has that experience. And I think part of what drives me in this broader quest to make equity a reality is a recognition that this is the value that so many of us want to see reflected in our country. It's what the kind of world that we want for our children long after we're gone here and our children inhabit this country and are leading the world. We want them to live in a world where they have a good shot at leading a healthy life, where the healthcare system will be there for them, where there's a public health system that's there to help keep them healthy in the first place. This is what we want for our kids. And that's why equity is so important right now, where we can't lose this opportunity to make it a permanent fixture, the central value that we build and rebuild our healthcare system around. And all of you are incredibly important agents in that change process, not just through the work you do, but through the advocacy that you provide, because your voice has great strength. And I know sometimes it can feel like it doesn't when you're out in the field and you're, slogging on your own in an exam room and you're wondering, God, is anybody listening to the concerns we have? Does anyone care? I want you to know that people are listening, people care. The people that I work with each and every day in this building, they care deeply. They hear those stories. Many of us are clinicians ourselves and have lived the experience of providing on the front lines with limited resources. And I hear people on a daily basis stand up and speak up for the needs of clinicians on the front lines. So I want you to know that we see you, we hear you, we feel immense gratitude for you for what you are doing. And I'm just so grateful for the opportunity to join all of you today.